Hi everyone, so today we're going to be talking about distribution and administration of medications, and depending of the medication and the route of administration is the steps that we have to follow to administer and to give this medication to the patient. So we want to follow the 6 rights of medication for the distribution. So we want to make sure that we have the right drug, that we have the right dose, the right time, the right roads, the right patient, and the right documentation. Once that we gather all our equipments, either the injection, either the needles, either the pills that we're gonna be giving to the patient, we want to make sure that we prepare everything and before entering the patient's room, right? Once that we gather everything and we are in the patient's room, we're gonna perform a second check or third check of everything one more time. We always want to make sure that we have the same medications that we have in our hands is the same medication that is on the MRA, which is the medical record administration system for medicines. We want to make sure that we have exactly the same amount. In case that we have to do any calculations, we want to do those calculations prior entering the patient's room. We always want to check those calculations with a different nurse, someone else. That's always is very helpful in case that you have any type of mistake or something like that. Of course, you want to perform after that hand hygiene and gather all your equipment to enter the patient's room. Once that you're in the room with the patient, you want to ask the patient for allergies. Always make sure, because there is a different allergies are completely different to any like interaction that this pill may cause, because the patient is taking a different type of medication as well, right? So we always want to check with the patient if they have any allergies, what type of allergies, and what is the reaction that this medication is given, right? Where let's say the patient said that is allergic to penicillin, we want to make sure what type of reaction is the patient experiences, right? We want to make sure that it's not a life-threatening condition or anything like that is where that may put the life in danger of the patient. Also, we want to make sure that there is no interaction with any other medication that the patient may be taking at the moment. Of course, the ones that were there, you perform a third check of everything one more time, that you have the right patient, that you want to use the 2 methods of identification for the patient, right? The date of birth. You may ask the patient, you may check with their on the record as well. And after that, you want to check one more time that you have the dose, the right medication for the right patient, right? So this will be your third check. Once that you're in the room with the patient, you're performing hand hygiene and everything. You want to have the exactly same amount that is supposed to be given to the patient, right? We want to have that prior entering the room to the patient, right? In case that we may do installations, we want to make sure to clean the area first, right? For the ears, for the eyes. In case of the ear, you want to do with the pen light, you want to assess first the area, that there is no wax, that the area is clean. You wanted to, in case that you're assessing for adults, you're going to pull back and up. In case that you're assessing for kids, you want to always pull down and you want to pull down and back, right? And in case of the eyes, the same thing. You want to make sure that you have the area is clean. You want to assess everything first, right? There is no irritation, that the pupils are normal. You want to always document any finding that you may see before administering the medication to the patient, right? In case that you want to do like installations of eye drops in the patients, you go like this, you open the sac, right, the conjunctiva sac that is there, and you want to drop the little drops there. Make sure that the patient is calm and relaxed, place it in a comfortable position for you, to make it easy for you to administer all those medications. In case that oral medications and sublingual medications, buccal medications, in case you want to make sure that the patient is able to do all that, right? In case that the patient is not able to do it, of course you want to do it, but always encourage all your patients to do it and place it in the right place of the mouth for the medication to take action. And in the case of injections, right, parental medications, you want to always, if in case that you have an ampule, you want to always break it away from you with a cotton swab, right, or alcohol or cotton swab. You want to break it away from you and try to avoid harm, right? Always be cautious with that. In case of the vials, you want to always take a little, the same amount that you're going to pull away from the vial, put the same amount of air first. You want to clean the area first. Of course, that you will have gloves on during that time, and you will perform sanitations, right? You want to clean the area first of the where you're going to inject for in the vial, right, at the top of the vial. You want to clean it with alcohol first, then you inject the same amount of air that you want to pull out, and once that you have the same amount that you're going to be given to the patient, is good to go. Or in case that you want to change the needle, you can do it at that time as well. You change the needle with the different needle that you're gonna, you may be using a filter needle to pull out the medication, right? And then you want to change that needle to the needle that you're gonna be doing the right injection for the patient. So depending of the route of the medication, basically are the steps that you're gonna be following. And always the 6 rights are always applicable for all of them, as well as the 3 checks that you have to do prior entering the room, while preparing the medication, and once that you're in the room with the patient. And always assess for allergies or any condition that the patient may give you or present to you. And always make sure that you have the right drug, the right medication, the right dose, the right patient, the right time, and the right documentation, and the right route. And that will be all for today. Thank you very much for watching.